For the last 16 months, we've been living with protective measures to stop the spread of COVID-19. We've protected ourselves and we've safeguarded our healthcare system. Now, many of these restrictions are now being eased in the community, and our staff and our physicians are going to have to learn how to adjust to changing restrictions in the community, and we'll need to understand what we're going to do within our facilities in order to protect ourselves and protect our patients from COVID-19. Now, while there may be fewer restrictions on what we can do in our day-to-day lives as healthcare workers, we need to remain thoughtful and we need to focus on the potential risks for patients, visitors, and ourselves. Now, what this means is that we need to continue to make safe choices to protect the vulnerable people with risk factors who we congregate in our facilities. They're at risk for severe outcomes, and we need to go above and beyond to ensure that we continue to protect them. The individuals who may not be fully immunized, patients under the age of 12 who are not eligible yet for vaccine, or for those who have conditions that mean that they can't respond well to the COVID-19 vaccine, or perhaps cannot get the vaccine. So today, I'm going to review our ongoing recommendations for PPE within our facilities. Bottom line, we are not changing anything as of July the 1st. We're going to maintain our current policies, and I'm going to briefly review what those are. So with regard to masking, again, masking is one of the most important things that we can do to help stop the spread of COVID-19 and to continue to ensure that we can provide safe care in our facilities. So at this time, there is no change to our continuous masking policies. Continuous masking will be continued for all staff, for physicians, for volunteers, for designated support individuals, and for visitors to our facilities. This will be in place province-wide in all AHS facilities. Of course, this includes acute care, continuing care, and community sites. It will also include COVID-19 testing clinics and immunization clinics. Now, as much as I'd love to say that this pandemic is over, we know that that's not quite true yet. We continue to have COVID-19 circulating, and we have variants that are circulating in our community, and we need to ensure that we don't introduce it and spread it in our facilities. Continuing masking is an important step that we can all take to protect those vulnerable individuals for whom we provide care, as well as protecting one another. Now, with regard to eye protection, again, this remains a critical component of contact and droplet precautions, even for those who are fully vaccinated. Eye protection, of course, has always been part of contact and droplet precautions and remains so. If you are in clinical contact, in other words, within 2 meters of an individual who has COVID-19 or might have COVID-19 or has respiratory symptoms suggestive of influenza-like illness or a respiratory infection, eye protection remains part of your personal protective equipment. We are going to maintain continuous eye protection in settings of COVID-19 units or outbreak units. Now, those who are fully vaccinated, meaning you're at least 2 weeks out from your second dose of vaccine, can stop continuous eye protection. But I remind you, it is still part of contact and droplet precautions in those settings that I just talked about. As long as fully vaccinated individuals remain asymptomatic, if you are exposed to COVID-19 in the workplace, you will not be quarantined if you are exposed. Now, on the other hand, if you are not yet fully vaccinated, you must maintain continuous eye protection as part of your personal protective equipment, as well as continuous masking, of course. And if you have an exposure, you will require assessment by workplace health and safety. And if that exposure is significant, you will be quarantined for a period of time after a significant exposure. Now, we've talked about masks and eye protection. I'd like you to remember that when you are treating a patient with suspect or confirmed COVID-19, we expect healthcare workers to wear a surgical or procedure mask together with eye protection, as well as gloves and a gown. Of course, a fit tested and seal checked N95 respirator should be substituted for that surgical or procedure mask for anybody who's in the room when an aerosol generating medical procedure is being performed on a patient with COVID-19, suspect COVID-19, influenza-like illness, or any changing respiratory illness. We recommend that an N95 be used as well in situations that involve prolonged, very close contact with a patient who's coughing, particularly if they're in the first few days of their COVID-19 illness, and particularly if you're in confined spaces where the ventilation may not be adequate. Of course, N95s are always needed and are always available, rather, as a part of a point of care risk assessment if you feel that you need one. Let me speak for a moment about hand hygiene. We've always known that hand hygiene is a critical strategy to reduce transmission of microbes in the healthcare setting. They protect patients, and of course, they protect ourselves and our colleagues. It is really important for everyone to clean your hands thoroughly at every stage of PPE removal, after you've left a patient's room, as well as before using high-touch objects such as a keyboard, a mouse, or a phone. Remember your 4 moments of hand hygiene. What about physical distancing? Well, as more and more Albertans continue to be immunized, of course, there are lots of questions that are now arising about whether we still may need to maintain that physical distancing. Now, over 70% of Albertans have had at least their first shot of COVID-19 vaccine. Over 30% are fully immunized, but we still have a ways to go before COVID-19 will no longer be a threat to us in the community. So to help ensure that we keep ourselves and one another safe, we're advocating that you still maintain physical distancing as much as possible, both in our facilities as well as in the community. As always, remember, stay home if you're feeling sick, cover your coughs and sneezes, avoid touching your face, your nose, your eyes with unclean hands, and clean and disinfect surfaces frequently that are commonly touched. So let me just sum things up by saying it's been a very long 16 months, and we're all exhausted of this. We all want things to go back to the way they were before this pandemic. However, as the world around us begins to open up, remaining diligent and adhering to the guidelines that I've talked about within our facilities remains really important as we continue to support Albertans when they need care, and as we continue to support and to protect each other. Within our facilities and within AHS, we're going to be taking a slow, cautious approach. So stay tuned. There will be more guidance coming. Remember that getting vaccinated is the single most effective strategy to protect yourself, to protect your family, and to protect the patients for whom you provide care. I want to say thank you to all of you. Thank you to all staff, physicians, designated support individuals, and visitors for continuing to follow this guidance as we work towards a more normal way of life for all Albertans as soon as possible.
Together, we do amazing things every day.